BSI Sinise. We're the EMTs. What happens?
She got scared and fainted, and I think she's having an asthma attack.
Okay, so number of patients, 1, NOI, asthma attack, considered additional resources, they're not needed at the time, and also considered C-spine. General impression, patient is in respiratory distress, LOC. Do you know where your name is? Do you know where you are? Do you know where you're doing? Do you know what time is it? Patient is A&O times 4.
Now we'll be checking for ABCs. So airway is open, breathing is tachypneic, and you can hear wheezing on inspiration and expiration. And then circulation, her skin signs, she's cool.
Intervention, we're gonna apply high O2, 15 liters per minute. And priority of patient is stuck. Symptoms, patient is tachypnea, wheezing on inspiration and expiration, poor circulation. Does your daughter have any allergies?
No, she doesn't have any allergies.
Does she have any medications?
She has albuterol for her asthma. I'll go get it from the car. Here you go.
Thank you. And then past medical history.
She's actually had a cold recently that has made her asthma act up, and she has past asthma attacks.
Okay, what was her last oral intake?
Candy while she was trick-or-treating.
And events leading up to
Trick-or-treating.
okay.
And now we're gonna transport.
Now I'm going to check her vital signs. Blood pressure is 90/50. Pulse is 130. Respiratory rate of 40. Her oxygen level is 88. Her respirations are 28. Control, I'm calling to ask for permission to administer albuterol to a 10-year-old having an asthma attack. Blood pressure is 90/50. Pulse is 130. Respiratory rate of 40. Medical history of asthma. She has had a cold. She has prescribed albuterol.
This is medical control giving you permission to administer the prescribed albuterol to a 10-year-old having an asthma attack with a blood pressure of 90/50, a pulse of 130, and a respiration rate of 40, who has a past history of asthma and has a cold.
Before we help administer with the albuterol, we gotta make sure we have the 6 R's, which is the right patient, right drug, right time, right route, right dose, and right documentation. Okay, so we're gonna exhale all our air out. Take a deep breath and then take an inhaler. And hold as much as you can and then let it out.
Assessing vital signs after 5 minutes of administering albuterol. Blood pressure is 110/80. Pulse is 115. Respiratory rate of 24.
They've now arrived at the hospital. We transferred care to the hospital staff. Report was 10-year-old female patient was found in respiratory distress with suspected asthma attack and vital signs of 90/50, pulse of 130, and respiration of 40, and oxygen level of 88. She had past medical history of asthma attacks, and her mother stated that she had a cold. We transported her and administered her prescribed albuterol, and vital signs improved upon arrival to the hospital. Blood pressure was 110/80, pulse was 150, and respiratory rate was 24.
is A and U times 4.
So we just say we're gonna transport. Alright, let me know. Alright, so take a deep breath, exhale.